Okay, today we have a nice young lady that has agreed to let us show how to remove a shoestring stitch. A shoestring stitch is a slip knot. It's done when people find it inconvenient to come back, either time-wise, travel-wise, or other situations. And therefore, this place, which has to be removed right here, will be removed, and then in 2 or 3 days, she'll be able to remove the stitch or suture, or whatever term you like to use in the medical field. She'll be able to remove it by giving a simple tug, which we'll show in just a few minutes. Place has now been removed, the stitch has been placed, and a short little end is cut. Actually, that's just a little bit too long. That's the way it goes when you're on action camera. And we have here a long end, which you can take your fingers and give a tug on, and out comes the stitch. And that's all there is to it. So we've got the stitch back in again, and we're going to put a spot band-aid over it. In 2 or 3 days, depending on what we tell you, the area needs to have the band-aid removed. A simple little pull on the stitch with the fingers, and it should come out. Sometimes when there's some bleeding, the blood will cause the stitch to glue together. You need to stand in the shower, let the water beam on it, and then give a tug on it. This all has to be done gently, but with a little bit of luck, it'll take care of it. Sometimes do have to call and do have to remove the stitch using scissors. This is a method that tends to do very well, tends to leave no scars, and makes it very convenient for people. The shoestring stitches are very useful, as I told you, but on the other hand, there are some problems. First of all, the spot band-aid, which was put on the stitch after we got through, it has to stay there for 2 or 3 days. You can't be taking it on or off, because you may accidentally remove the stitch, because the part that is the long end may stick to the band-aid. So you have to be committed to leaving the band-aid on for the period of time. Another problem that might occur is, what if you bleed under there? What do you do? Well, that is a problem, and you do need to call, because bleeding under there is not good news. We don't like bleeding. We don't want you to bleed. Usually, ordinarily, we tell you what you need to do, and we don't even use the stitch if we think you're going to have some problems with bleeding. There's also the person who comes in here a week or 2 later and they still got the spot band-aid on, and they never did remove the stitch nor the band-aid. That's the individual we also worry about. So remember, you need to know exactly what needs to be done. If you're not clear, you need to ask us. If you don't remember to ask us before you leave, got a telephone, please call.